A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. As I start the CMA with the name of Allah, who is very helpful, very merciful, and very kind. CME update by Mother and Child Survivor Group of Pakistan, and me, Dr. Tariq, Ops Gynae Family Emergency Specialist, Internist, Gulf KSA, presently a district gynecologist. The topic for today, for today's CME is contraceptive methods and contraceptions. There are a number of drugs, IUCDs, level norgestrel intrauterine LNG system, and there are implanon IUCDs, copper IUCD, and there are emergency contraception, and then there are vaginal ring, and then there are patches. So combined oral contraceptive pills are the most effective one, have an efficacy of 0.3 and per 100, and they contain a combination of this ethyl estradiol and progesterone. So combined oral contraceptive pills, their mode of action is similar, that they inhibit the implantation by changing the endometrial environment, and also inhibition of ovulation and thinning of the endometrium, so that penetration become difficult. They are in various combinations. They are used as the combination of estrogen, ethyl estradiol, and progesterone as progestogens, northestrone, ethinydiol, and others. Mostly are the northestrone. Second generation are gestodine and gestodine and all these, and third generation are legitimate and others. Third generation have the disadvantage that they are having the increased content for thromboembolism. There is yasmin, which also contains drosyperionone, and then there is cocyprindiol. It also contains this. It's good for acne and hirsutism. It contains an anti-androgen with cocyprindiol with the name of Dianate. Now, what are the contraindications for their use? Number one is to rule out the pregnancy, then hepatic and liver disorders and the tumors, and then we have to see the infections, sexually transmitted diseases, cardiovascular diseases, hypertension, and others, increase BMI and increase weight also. Infections are also an important part to be sorted out. And then their uses are, they not only decrease the menstrual blood flow, they regulate the cycles, they bring the erratic bleeding under control, and they regulate the menstrual cycle, and they decrease the incidence of pelvic inflammatory disease, they decrease the incidence of infections, they decrease the incidence of ovarian tumors, ovarian cancers, as well as colorectal cancers, and they are also used in the various conditions, and for especially heavy menstrual blood flow. They are used for controlling the and regulating the cycles. Regarding the incidence of their side effects, I have told already that they are not indicated. First, we have to rule out the pregnancy, sexually transmitted disease, the pelvic inflammatory disease, infections, liver diseases, hepatic disorders, and hepatic tumors, and extra. And also they are having an increased risk of what you call as stroke, thromboembolism, and cardiovascular disorder, ischemic heart disease. They have some incidence of headache also, which can be adjusted with the dose adjustments. The other is this is combined COCP, combined oral contraceptive pills, and the others are this they are also used for reducing the size of the fibroids, but GnRH analogs are the best one. Then come the progesterone only pills, POP. They also have this very good efficacy, 0.3 or 0.4 per 100 ml per 100 women, and they are used when there is contraindication to the estrogen estradiol component, and like for example in lactating women, in the what you call SLE, and in autoimmune diseases like rheumatoid arthritis and others, SLE. And then they have also been are very effective, and their mode of action is the same as inhibition of ovulation, and to prevent and inhibition of ovulation, and thinning of the endometrium, and thickening of the cervical mucus, so as to prevent implantation and making the motility difficult. These they are if the POPs are progesterone only pills, and if they are taken on the same day, it's very effective. Like the same combined oral contraceptive pill, they are also taken at the same time of the day each day. And then if they are used in day 1, if they are used, they can be used in the cycle, or if they are used in day 5, then additional contraception is needed. And if they are missed in the day 5, in 2-3 hours or last dose 27, then additional pill is taken, and the rest pills are taken at the usual time, and then additional contraception is needed. If vomiting in 2 hours, then another pill is taken, and extra contraception is advised. Then comes the Implanon. Implanon is basically progesterone containing it's a hormonal containing device, and it is fit in the, now it is known as Nexplanon. Before it was marketed as Implanon. It is inserted into the subcutaneous area of the arm by giving an incision with a very good applicator, and it can be used for 3 hours, and it is also having the hormones released gradually, and it contains the same, it can be you both estrogen and progesterone. As the mode of action is also the same, it prevents the placing of it prevents the motility of the sperms, and then the penetration become difficult and thinning of the endometrium, so that implantation also become difficult. This is Implanon and COCP progestogen only pills, and then comes the copper intrauterine containing devices. They are inserted at the time when postpartum. They are inserted after 21 days and or 4 weeks, and otherwise they can be inserted at any time of the cycle. And they are also having, with their copper containing, they inhibit the motility of the sperms, and also they have prevent the inhibition of they also prevent implantation difficulty of the sperms. They are first have to be see that there is no pregnancy and there is no sexually transmitted disease, and then there is no infection, and there is no STDs, infections, and pregnancy, and other disorders as well, like follicular cysts. Then there you see it is this can be used at any time during the cycle as mentioned. And then comes the LNG intrauterine system with the popular name of Mirena. It is also a very good effective contraceptive with having a 0.18 efficacy rate per 100 and it contains the LNG 52 milligram LNG, and it is released 20 milligram daily, 20 microgram daily, so that, and it is very effective contraceptive, as well as it also reduces the menstrual blood flow, especially when there is very heavy menorrhagia, intractable menorrhagia, and its progesterone arm is used as contraceptive. It has been very effective, like endometrial ablation. And the side effects of all these contraceptives are most COCP, breakthrough bleeding, and the progesterone also have bleeding, irregular bleeding, regular bleeding, and sometimes amenorrhea. Similarly, it has also this erratic bleeding for 3-4 months, this Mirena IUI system. And this is also very important, and it can be used in the one who is having progesterone containing, the woman who wants progesterone containing use these drugs for the contraceptions, and they can be used for breast cancer as well by the consultation of breast surgeon. So in summarize, COCP, and then comes the progesterone only pills, then Implanon, then copper containing IUCD, and then this working of intrauterine system. Side effect as mentioned of all these also mentioned. Some they have irregular bleeding, some they have erratic bleeding, some they have amenorrhea, some they have and also bleeding, irregular periods, and then amenorrhea. So this intrauterine system, Mirena intrauterine system, is very effective, and it is used for many years. For 5 years it releases the depot preparation, and for controlling and regulating for controlling and regulating the menstrual blood flow, and also for the contraception, and can be used in breast cancer as well. Then there are emergency contraception, which are used basically in 72 hours, like LNG 1.5 levonorgestrel. It is not efficacy. It's not effective after 72 hours. Though if it is efficacy is not there, so it cannot be commented. And there is ulipristal. This also progesterone modulated. It can be given also in 120 hours of this unprotected intercourse. And then comes the these are all the and then come the IUCD. IUCD also can be used in the 120 hours of day, and they can also prevent this by direct toxicity and by by interfering with the motility and thinning of the endometrium. By direct motility and all this, and thus becoming implantation very difficult. So this is regarding the increased content of the thromboembolism. This is very important, especially this COCP, estrogen contraceptive pills. They have the highest incidence. With this first generation, it is background risk is 5 to 1 lakh, and the second generation it is 15, and third generation it is 25, while with pregnancy it is 60 per lakh women. So it has to be sorted out, all these investigations to be done so as to rule out liver and hepatic disorder, cardiovascular disorder, diabetes, hypertension, metabolic disorder, dyslipidemias, liver and hepatic tumors, and others, especially using this cervical cancer also, and those who are smoking, and those who are having increased BMI and increased weight also. As with these complications they are increased. So we'll come with another CME sometime. Thank you for the patience listening. Goodbye and salam alaikum. And we must not forget our past, and our takeaway lesson is pray, praise, trust, love God Almighty Allah, and follow Rasulullah sallallahu alaihi wasallam, our health and survival, and our glorious past. तो नीम इनकी ठोकर से सहरा और दरिया, सिमट कर पहाड़ इनकी हैबत से राई. And we all should always talk, pray and dua from Allah. हम तो माइल बकरम है, कोई साइल ही नहीं, राह किसे दिखलाएं रहबर मंजिल ही नहीं. And Allahumma ajirna minan nar, save us from the fire of Jahannam. Allahumma zikrak shukrak wa husn ibadatak. And also فَبِأَيِّ آلَاءِ رَبِّكُمَا تُكَذِّبَانِ. We must always thank Allah. And with this week, best wishes and regards. وَمَا عَلَيْنَا إِلَّا الْبَلَاغُ. Thank you very much.